Hi, my name is Dana DeAngelis, and I'm the stroke coordinator at Hunterdon Medical Center. May is Stroke Awareness Month, and we at Hunterdon want to remind our community that stroke is a medical emergency. If you or one of your loved ones is experiencing signs and symptoms of a stroke, please don't hesitate and call 911 right away.
Welcome to National Stroke Awareness Month. I'm going to speak to you about what happens in the pre-hospital setting, whether at home, work, or just out in public, when you experience a stroke and you need to call 911. Don't hesitate to call 911. We're here to help you. Most people don't even realize when they're starting to exhibit signs of stroke. It is often family members or friends who identify the stroke and makes the 911 call for you. Don't deny the symptoms that you're witnessing. Call 911 quickly. When you do call, anticipate the 911 dispatcher to be direct and to the point. The dispatchers are trained to provide you pre-arrival instructions to help the patient if needed. They may ask you to have ready, if possible, the patient's list of medications, any known allergies, when the patient was last seen normal, and the patient's ID insurance card, if possible. When the EMTs and or paramedics arrive, they will want to collect the patient's information, perform a detailed assessment, general appearance, skin cool color, temperature, lung sounds, blood pressure, medications, allergies, etc. They then perform a key neurological exam focused on the signs and symptoms. The paramedics will evaluate an expanded Cincinnati stroke looking at balance, eyes, facial symmetry, arm drift, speech proficiency, and time in transport. They will also gain IV access, verify your blood glucose, along with a 12-lead EKG. While the patient is being moved into the ambulance, the paramedics will call the medical command and make notification of a stroke alert from the scene. This allows the receiving emergency department and radiology to be geared up in anticipation of an arriving stroke patient. All these steps combined save valuable time and set the stage for a rapid transfer of the patient to the CT scanner for imaging of the brain. Lastly, our MICU and rescue squads take every preventable COVID precaution by sandy wiping all surfaces and utilizing ultraviolet light for disinfection. All providers with direct patient contact will don personal protective equipment, both for your and their own safety. Don't delay, call 911.
Time is brain. Every 15 minutes of a large stroke is equivalent to the number of brain cells that die in a normal year of aging. Don't let your concerns about COVID delay your stroke treatment. As soon as you recognize a problem, call 911.
B.E.F.A.S.T is the acronym most commonly used to identify signs and symptoms of a stroke.
B is for balance. This includes trouble walking, dizziness, loss of balance, or loss of coordination in one of your arms or legs.
E is for eyesight. This includes trouble seeing or new onset of blurry vision in one or both eyes, double vision, or feeling as though there was a curtain being pulled over your eye.
F is for facial asymmetry or unevenness. When you smile, do you notice that one side of your mouth is not the same as the other?
A is for arms. When you hold your arms out in front of you, is one of them drifting down towards the ground?
S is for speech. This includes slurred speech or lost ability to understand or express your thoughts.
T is for time. Act fast and call 911 right away.
80% of strokes are preventable.
HMC treated 380 TIA stroke patients last year.
Stroke can happen to any person. It does not discriminate.
Stroke is the leading cause of disability and the 5th cause of death in the U.S.
One positive FAST sign is an 80% predictor that you're having a stroke.
The more delayed your arrival to the hospital is, the less options for treatment and the more chance of permanent disability. Don't wait.
Having a TIA or mini stroke lasting 1 to 2 hours with resolution of symptoms puts you at a 1 in 3 likelihood of having a stroke within the next year.
Our team of ED providers are highly equipped to provide optimal stroke care through rapid identification of symptoms 24/7.
Don't let this pandemic be the reason for the delay. Time is brain. If you think you're having a stroke, call 911. The Hunterdon Medical Center is ready and prepared to take care of you and your loved ones.
So remember, stroke is a medical emergency. Act fast and call 911.